The image shows an infant with a vascular lesion on the right cheek, characterized by the following features: a well-demarcated, dome-shaped lesion, approximately 2 to 3 centimeters in diameter. The lesion has a bright red to purple periphery with a central pallor, suggesting superficial ulceration or necrosis. The surrounding skin appears normal without signs of spreading erythema or edema. The infant is otherwise well-appearing and using a pacifier. Medical impression: this is most consistent with an ulcerated infantile hemangioma. Infantile hemangiomas are benign vascular tumors commonly seen in infancy. They typically proliferate rapidly during the first few months of life and may ulcerate, especially in areas subject to friction or moisture, like the face, perineum, or neck. Clinical notes for revalidation purposes: Puerto Rico. Diagnosis: ulcerated superficial infantile hemangioma. Age group: infant. Common complications: ulceration, as seen, bleeding, pain, potential for secondary infection. Management: wound care, gentle cleansing, barrier protection. Topical antibiotics if secondary infection is suspected. Pain control: consider systemic beta blocker therapy, e.g., propranolol, if lesion is large, complicated, or causing functional, cosmetic concern. Referral to dermatology or pediatric specialist if needed. Let me know if you'd like this written. Sure. Here's the medical board-style question in English, suitable for the Puerto Rico revalidation exam format. Medical revalidation question, Puerto Rico. A 2-month-old infant is brought to the clinic by her mother because of a red lesion on the right cheek that has been growing since the first few weeks of life. The mother reports that the lesion recently ulcerated and the baby cries when it is touched. Physical examination reveals a well-demarcated nodular lesion approximately 2.5 centimeters in diameter, bright red in color with a pale central ulceration. The infant is afebrile and appears otherwise well. What is the most likely diagnosis? A. Ulcerated infantile hemangioma. B. Congenital cavernous hemangioma. C. Port wine stain, nevus flammeus. D. Kaposi sarcoma. E. Congenital melanoma. Correct answer A. Ulcerated infantile hemangioma. Explanation: infantile hemangiomas are common benign vascular tumors that typically appear within the first few weeks of life, rapidly proliferate, and can ulcerate, particularly in areas exposed to friction or moisture, such as the face. Ulceration is the most common complication and may cause pain, bleeding, or secondary infection. Management includes gentle wound care, pain control, topical or systemic treatment, e.g. propranolol, and referral to a specialist if needed. Let me know if you want a full set of review questions